What a wonderful conference this has been so far. When we took a chance on a virtual conference, planning a virtual conference last year, it was a small but mighty group of our leadership team last year. We were just blown away by the passion and commitment and the depth of conversation from our panelists, participants, and our presenters. And I'm equally thrilled this year. I'm so excited to continue providing this space for oral health advocates to come together. I'm just so energized by all of the conversations that we've heard and really building these bridges together. So as you all know, I'm Brianna Miller, coordinator for the Arizona Oral Health Coalition. I've been the coordinator now for about 4 years. Don't come from an oral health background, and now I'm a believer and I'm very passionate about oral health. So I'm just so happy to continue doing this work with you all. Again, like I said, I'm just going to share a quick update from our coalition and what are some of the things that are on the horizon. And then you will get to hear again about Northern Arizona Oral Health Coalition as well. So get comfortable. This is the last part of our afternoon together. I hope you all have enjoyed everything as much as I have. All right, next slide, Taryn. So I think most of you are familiar with us, but in case we have any new folks on the call, we are a dedicated group. I realize I can't really pronounce the word cadre. I think I say that wrong. So a group of oral health advocates comprising a large cross-section of health professionals, community leaders, policymakers, and grassroots organizers. We exist to create meaningful discussions like we've been having throughout this whole day and impact change to address oral health disparities in Arizona. Our vision is to see an Arizona where everyone can enjoy the benefits of good oral health. And we want to be the catalyst that sees that happen. Next slide. All right, so those of you who have been around, we have Jan and Jen and some folks who have been around for the sort of since the beginning of the coalition. We don't have the full timeline here on this slide, but we have been through many changes over the years. Started with a rapid growth in membership, which really aligned with the 2019 AZPHA conference. That really energized folks to sort of join our coalition. And then, as is life, as quickly as momentum picked up, 2020 happened and we saw advocates' capacities pulled in many different directions. We heard a lot about that today and the impacts that COVID had on all of the work that we do. We experienced a lot of change at this point as well. Good change though, partnering with Children's Action Alliance and really taking a more targeted focus on oral health advocacy as a result. 2021 saw the creation of our work groups and at the beginning of sort of having a larger strategic conversation about what levers exist to impact change in oral health and in oral health equity. We talked about many of those levers today. While 2022 saw a general kind of decline in our work group membership and a shrinking leadership council, again, as I think everyone was sort of feeling the brunt of the pandemic and being pulled in many different directions. But 2022 also saw a big growth in our advocacy committee and also marked our very first Capitol Day. Since then, we have continued to partner with Children's Action Alliance, it's still our fiscal sponsor, to grow our influence down at the Capitol. We've hosted 2 now statewide all-member meetings, and we continue to elevate the conversation around oral health at the legislature and in communities. With our leadership restructure this past year, we're more excited than ever to continue working to make our vision of an Arizona where all people can benefit from good oral health a reality. Next slide. So this past year has been very influential. As I mentioned, our restructure has allowed us to begin connecting with members in new and exciting ways and kind of streamlining our focus, allowing us to start carving out our niche in the oral health advocacy space. So with the dental therapy rules finally behind us, we just heard an update on dental therapy. We're kind of moving into that next phase. We were really kind of behind the scenes in working on getting those rules passed and getting the legislation passed. So we're really happy that we saw that happen. So now we've really turned our focus largely to an adult dental benefit in Medicaid. We've talked a lot about that today. And one of the things that we were really proud of doing this year is bringing together brilliant minds from our members to propose 3 different policies aimed at providing oral health for low-income individuals most impacted by oral health disparity. So we got to work with our grassroots partners to really refine these 3 proposals. We even worked with Access to assess the financial or fiscal possibility of each. And through this exercise and collaboration, we were able to build a really strong consensus around pursuing a full, comprehensive adult dental benefit for folks in Medicaid. We were able to locate a strong sponsor in Senator TJ Shope and gain more bipartisan support despite a full comprehensive benefits larger fiscal note than, say, the preventative benefit of last year, or some of the benefits that we've tried to promote in the past. But we've really seen more support than ever before, as I think Jen mentioned as well. We've made new connections with amazing organizations like the Arizona Food Bank. We heard Ashley talk a lot about that, who was on that panel today, in really supporting that bill that would extend pandemic era school meal support, ensuring students receive that adequate nutrition, which we know is fundamental to oral health. So making some of those connections and building stronger networks within our organization. And our profile, as well as the amazing work that you all and we are all doing, has really grown. Our members have been featured in local and national news stories this year about dental therapy implementation, Medicaid dental, and our listening work, which will actually be featured in an upcoming CareQuest video blog, so be on the lookout for that. We've also had the opportunity to engage with partners on a national level. You heard some of our national partners speak, members of Open. We've been able to engage a lot more there and bring more awareness to the work that Arizonans are doing in the oral health space. We are also really excited to announce that we have applied and hopefully will receive another round of funding from CareQuest. So we look forward to just building on all of this great work into the future. So as mentioned, one of our goals this year has been to re-engage with our members. So this is something we hope to be able to continue to do and do better. So we did start hosting a monthly happy hour as a way to kind of kick back, relax, and connect while we're spilling tea on hot topics in oral health. I think we talked about Botox last time. We've talked about a lot of just kind of like hot topics, and they're really great ways to just connect in a low-key environment with everyone. So if you haven't had the opportunity yet to join us, we look forward to seeing you. Check out our calendar of events. It's the second Thursday of each month. We host this happy hour. So we'd love to see you all there. Next slide. And AZOHC was back at it again this year. We had another amazing Capitol Day. We were super stoked to be able to lobby Senator Shope's comprehensive dental bill, which did make it out of the Senate with bipartisan support. The bill is still part of the budget negotiations. It seems like this is probably wrapping up to probably another longer session, hopefully not as long as last year. But we know that it's not likely to get funded this year just because we are operating with a very large deficit. We could talk about that forever, but I won't go into that right now. But still, over 40 advocates showed up for Oral Health Day at the Capitol this year, and we know we are making a difference. We know our voices are louder together, and we look forward to making dental that take-home issue in sessions to come. As Jen said, maybe next year will be the year, but we're getting close. I can feel it. So if you want to get more involved with this part of our work, you can visit our advocacy page. I'll drop the link in the chat. When I'm done, you can always just email me to get involved in our advocacy committee and take action in those ways. And of course, sign up for our newsletter because that's the best way to stay connected with us. Next slide. We were also so excited to be able to provide more learning opportunities for our members this year. And we look forward to doing more of this in the coming years, providing more CE and just more chances to learn. So coalition members gave a CE training. It was our first CE training this year on health equity for oral health advocates. They've really brought together their many different perspectives and experiences, really bridging understanding related to the importance of cultural competency and addressing social determinants of health, really growing our stakeholder engagement and widening the reach of our advocacy efforts. Like, again, we were so happy to be able to do that social determinants of health panel today, really widening the view of who can be an advocate for oral health and who is important in this mission. This year, we were also really excited to sponsor a booth at the Arizona Dental Association Western Regional Dental Conference. It was not cheap, but it was a really good experience. Our coalition members had a great time connecting with practitioners, academics, and other advocates, further uplifting the work that we do as integral to the oral health profession as a whole. We were able to draw attention to how oral health equity impacts every facet of dentistry and why providers are powerful advocates in the quest for better oral health. So we hope to continue leveraging those connections, and maybe you'll see us at the Western region next year as well. We'll be. Next slide. All right, so looking forward again, I just want to thank all of you for continuing to support our work and for the work you do every day to make Arizona a healthier place for everyone. We hope you will continue to stay connected with us. We are always happy to hear feedback on the needs of our members. If there's something you'd like to see more of, if there's something you'd like to see less of, emails on the screen, always reach out and feel free to let us know if you want us to promote something in our newsletter. We really want to make those connections for everyone. So I will now hand it over to Peter to talk about the great work being done up north.
Better unmute myself if I'm going to present. Thank you so much. Tough act to follow. You guys have been doing some great work. I appreciate you sharing about that. Hello, everyone. I'm Peter Van Wyk. I'm a member of the Northern Arizona Oral Health Coalition. Unfortunately, our chair, Sandy Perez, couldn't be here today, but we wanted to make sure that we shared some of the work that we've been up to this past year. We're very excited. Oh, I may advance the slide. So really, this past year has been a tale of some partnerships and collaborations really elevating our work to a new level, and we've been very excited about that. In particular, our Northern Arizona Oral Health Hero Award. So this is our 4th year awarding this. It's been very exciting, the development that's taken place during that time. And this award goes to those in the community, someone in the community we feel has really gone above and beyond in meeting the needs and addressing the needs of adult oral health care in Northern Arizona. And I want to really give some thanks, I guess, and appreciation to Delta Dental. I see Barb's on here as well. I want to really shout out Barb. She's been remarkable. Her and, of course, Delta Dental have been just great partners in elevating the profile of this award, and in turn elevating, therefore elevating just the awareness of the importance of oral health in our area. It's been very exciting. This past year, we were excited to award, hopefully someone that might be familiar face to folks on this call, but Dr. Jonathan Robinson. Dr. Robinson has been just a cornerstone of oral health here in Northern Arizona for his entire career. Outside of his own practice, he has volunteered countless hours, as you can see, at Sid Davis Dental Clinic, AZ Moms, and our own events at Northern Arizona Dental Days, which I'll jump into in just a little bit. We were very excited to award him. He's just a beloved figure throughout the community. And we hope to do a little bit of a roadshow with him this next year, kind of showing him off the different events that we go to and really recognizing his work. He really has done some remarkable things. Next, this past year, we've again put on our Northern Arizona NAZ Dental Days program. So this is our 2nd time holding this event. And this is really, these events were created in response to what we saw as, again, as a lack of access for folks in need in Northern Arizona in accessing oral health resources. So this was very much created in the image of AZ Moms, in which we're pulling together oral health professionals to provide free resources and procedures to patients that have high needs here in Northern Arizona. As you can see, again, this was a story of a lot of partners coming together to produce some great work. You can see the partners listed there. Again, beneath the title there, I want to call out Delta Dental again for their partnership in this. Really been a key partner in all the work that we've been doing. So as you can see in 2023, that was our first time hosting this event. We hosted it at North Country Healthcare, which some of you might be familiar with, at their site here in Flagstaff. We were able to provide services to 66 patients, and we were very excited to have 99 volunteers sign up. We think both the number of patients and the volunteers really speaks to the need in our community that folks were that willing to show up and provide support for this event. Very excited. Additionally, we were able to provide $45,000 in free dental care services to those patients. And that just snowballed again. We decided we need to host the event yet again. And this past April, we hosted it. This time we were able to host it at the NAU Dental Hygiene Clinic, which had more chairs, which we were excited. We could provide more services to more patients. And again, we had 80 patients and 115 volunteers this time. Again, we really think this is reflective of the need folks see in the community. And we were just surprised and excited about folks' willingness to help out and be a part of really meeting the needs of some of our high need folks here in our communities. And we were able to provide over $70,000 worth of free dental care. Again, one of those transformative experiences where you go and just witnessing things are just fantastic. So I highly encourage folks to come if they can. It's fantastic. And again, due to the success of this and the partners, the excitement of the partners coming together, we are planning on hosting more of these again. They just reconvened again to start planning for what we can do maybe in 6 months to a year. So looking forward, Sandy, our chair, wanted to put something on your radar here. She and the coalition will be hosting several learning sessions, as we might call them, throughout the year. And the next one's planned. We still don't have details around date or time, but she's putting together a learning session regarding that she's calling fluorides to peptides. So she's going to walk through non-invasive treatments, early caries, and of course, curodont, and how that's impacting the oral healthcare field. So we're very excited about that. So please keep a sharp eye on your emails for any potential updates and flyers for that. And lastly, that's it. Thank you so much for having me here today. We really appreciate it. The coalition as a whole, we're always excited to share a little bit about our work. And if you want to sign up, please feel free to sign up for our newsletter. We'd be excited to include you on that. And there's my contact information as well as Sandy. So again, thank you so much for having us here. And let me know if you have any questions.